Il 15 e 16 maggio 2015 i massimi esperti nazionali e internazionali di malattie reumatiche ed altri specialisti medici si sono riuniti a congresso presso il Policlinico Umberto di Roma, Università Sapienza, per confrontarsi sui nuovi piani diagnostici e terapeutici per 10 principali patologie, fra le quali la sclerosi sistemica, la sindrome di Sjögren, l'artrite reumatoide, la polimialgia reumatica, la spondiloartrite e il lupus eritematoso sistemico, l'ES.
Questa riunione scientifica che abbiamo organizzato oggi è un ritorno, nel senso che l'ultima edizione di questo 10 Topics Rheumatology l'avevamo fatta 10 anni fa e poi per una serie di motivi non avevamo mai più fatto e in molti ci sollecitavano, eccoci quindi ritornare. E ritorniamo con 10 argomenti di grande attualità che riguardano intanto le novità in termini di terapia delle malattie reumatiche, poi novità in termini di possibilità diagnostiche delle medesime malattie e ancora novità in termini di conoscenza dei meccanismi patogenetici che sono causa di queste malattie.
Thank you, and thank you for inviting me. It's very exciting for us because we have identified a condition that can be treated. It causes in women pregnancy losses, and that can be treated. And it causes many symptoms like migraine, headaches, strokes, and we can prevent them by simple blood tests. And one of the big bits of research for us has been in collaboration with the group here in Rome. We've now, last 10 years or so, we have been working together because the tests still are not perfect and they need development. So that's the basis of our research. For me, very important aspect for patients. And I hope we'll hear more in this meeting about it. Thank you.
Thank you very much. I'm delighted to be here, and it's wonderful to renew acquaintances with Professor Conte, who spent some time with us in Manchester recently, where we developed some ideas for a research program looking at novel biomarkers for patients with lupus and renal disease, or lupus nephritis as it's known. There's also a lot of shared interest in cardiovascular risk in lupus, and one of the subjects of my talk this afternoon is to highlight the importance of early cardiovascular disease in patients with lupus. Women with lupus get this problem at a very early age, and one of the areas that we've been interested in studying is metabolic syndrome, which is essentially a pre-diabetic state. But this also gives us clues to the risk factors for cardiovascular risk in lupus, and those include ethnicity. Certain ethnicities seem to be more prone to developing metabolic syndrome, but then also steroids seem to exacerbate the problem, and of course we use steroids a lot in this clinical situation. But also anti-malarial drugs, which are drugs that we use a lot, seem to reduce the risk. So we think it is probably multifactorial, the cardiovascular risk, some due to standard risk factors and some due to other things like the inflammation and then the treatments that we use.